My name is Sarah Murphy. I'm Executive Director of the New York School-Based Health Alliance. The School-Based Health Alliance is actually an organization representing 252 school-based health centers across the state. School-based health centers provide more than 200,000 students, mostly low-income Black and Latino, with comprehensive primary and preventative medical care, reproductive health care, dental, vision, nutrition counseling, and mental health services on-site in schools at no out-of-pocket cost. They are often the only providers available to children and adolescents in rural areas. Today, I am joined by the Honorable Assemblyman Richard Gottfried, Chairman of the Assembly Health Committee, the Honorable Assemblyman Felix Ortiz, Assistant Speaker, the Honorable Senator Neil Breslin, who we hope will come, Mamba Chia, who is Director of Public Health, Women and Children's Hospitals of Buffalo, Kaleida Health, David Shippey, President and CEO of Whitney M. Young Health Center, Julie Marlette, Director of Government Relations for the New York School Boards Association, and John Green of the New York State United Teachers. Our purpose today is to call on the governor to sign legislation, Senate Bill 6012, Seward, or Assembly Bill 7866, Gottfried, to pull the state school-based health centers back from a financial cliff. Starting next July, the State Health Department will stop making Medicaid payments directly to school-based health centers. Instead, the Health Department will disperse premium payments to Medicaid managed care health plans and eventually force the centers to negotiate contracts and reimburse the rates with those reimbursement rates with those plans. This year, Assemblyman Gottfried and Senator Seward passed a bipartisan bill to require the State Health Department to continue to pay SBHCs directly for the services they provide to children insured by Medicaid. The Alliance and dozens of health organizations and education organizations strongly support this legislation, and we call on the governor to sign it to save school-based health centers. Now, I would like to introduce our first speaker, Assemblyman Richard Gottfried.
Thank you. For as long as I've chaired the Health Committee, I have believed that there is really no finer part of our healthcare delivery system in New York than school-based health centers. They provide accessible care for kids who need it without their parent having to take a day off from work to make a daytime appointment. They help cement kids to school. For many kids, the school health center is one of the things they like most about their school. They are a gateway to connecting kids and their families with a broad range of other health and other human services. They're just a terrific part of our healthcare system and our school system. But they have always been hanging on by their fingernails financially. Part of their ability to survive has been the fact that they can bill Medicaid directly for kids who are enrolled in Medicaid. The health department has for some years been trying to move the whole school-based health center program into Medicaid managed care, which would mean that each health center would have to have a contract with every one of the numerous Medicaid managed care plans that various of their students might be affiliated with. Instead of getting paid simply and easily by the Medicaid program, there would be endless difficulties in getting care approved by a managed care plan. Managed care plans, if you're going to somebody who isn't your primary care practitioner, they want you to have a referral from your primary care practitioner, which is completely opposite to the way a school health center works. They thrive on the ability of a student when they feel the need to drop in and talk to the healthcare providers there. So this bill would say that school-based health centers can continue to operate billing Medicaid directly for Medicaid-eligible children. It would allow them to participate in a managed care plan if they choose for given students, but it would make sure that they were treated fairly and paid fairly. And it would also make sure that traditional Medicaid pays them fairly. It's critically important to the survival of a really wonderful part of our healthcare system and our educational system, and we are urging Governor Cuomo to sign the bill.
Thank you so much. Thank you, Assemblyman. Up next is Mamba Chia, who is Director of Public Health, Women's and Children's Hospital of Buffalo of Clyde Health.
Thank you, sir. Good morning, all. My name is Mamba Chia. I'm the Director of Public Health, Women and Children's Hospital of Buffalo. And in my role, I oversee 8 school-based health centers throughout the city of Buffalo, which currently provide services for close to 6,000 kids. School-based health centers provide medical and mental health services that allow students to achieve academic success. These services reduce barriers to learning by allowing the students access the care they need without the need to leave their school premises. As such, it improves academic attendance and minimizes time spent out of the classroom due to illnesses. The preventative care services offered at these school-based health centers keep our kids in school healthy and avoid preventable illnesses and disease that will keep them from attending school. It also helps families save money on expensive emergency room visits, as well as prevents families from taking time off of work to rush the kids either to the ER or to doctor's appointments. School-based health centers helps to reduce racial and ethnic health disparities by providing culturally sensitive services to minority ethnic groups, including but not limited to the Latinos, Hispanics, and the African American students. They provide any student's primary and preventable medical care, reproductive health, dental care, vision, nutrition, counseling, and mental health services on site with no out-of-pocket costs, while saving the states millions of dollars year in, year out. In Buffalo, we particularly partner with community-based organizations to continuously engage sick kids in and out of schools and partnering with their families to ensure that we continue to engage them to follow through with medical directives and to further enhance health literacy, all aimed at improving the child's health outcome. Without permanent carve-out provided by this legislation, we are in danger of losing those vital services. Next year, school-based health centers are scheduled to be carved into Medicaid managed care, and the State Department will stop making payments directly to the school-based health centers. This will force school-based health centers to pay health plans a premium for those services they provide and require to negotiate contracts and reimbursement rates with those plans. There is no guarantee that the premiums paid to the health plans will cover the increasing needs of the children we serve by these centers, especially in Buffalo, where we have new Americans increasing in numbers. This new payment structure creates costly administrative burden for the hospitals like ours, as well as clinics that support these school-based health centers. Many school-based health center providers across the state, including us, do not see this as a sustainable future for the school-based health center operation if these changes goes into effect. We predict that many centers will have to close its doors, eliminating those very needy services that our children depend on, understanding that the health of our kids today is the health of our communities tomorrow. Given that uncertainty at the federal level, New York State must act to preserve services that help keep children healthy. This legislation will give help assured to the school-based health centers to maintain and have a sustainable future with adequate payments to continually sustain the program. Preserving school-based health centers translates into preserving children's futures. I would like to especially thank Assemblyman Gottfried and Senator Stewart for sponsoring this legislature and providing the opportunity for school-based health centers to continue helping students. We urge the governor to please sign this bill and keep children's health a priority in New York State. Thank you.
Thank you, Mamba. Next up is David Shippey. He's president and CEO of Whitney M. Young Health right here in Albany.
Good morning, folks. Thanks for the opportunity to talk a little bit about what school-based health centers mean here in the Capital District and about the impact of this potential carve-in of Medicaid managed care if we don't address a fix on this in the long haul. So at Whitney Young, we have 3 school-based health centers here in the city of Albany. Our partner FQHC over in Schenectady operates one there. So in the district, Capital District here, we have 4 of those. In our case, we see about 1,000 kids in those 3 schools that we're in. And I guess I would just highlight, and I know it's probably improper English to be talking about with school-based health centers, but if it ain't broke, we don't need to fix it, probably. But I think if we look at our own organization and if we match that, the outcomes that we're looking at clinically in moving forward with a value-based purchasing proposition and meeting the goals of the 5-year district run here in New York, when we look at the quality outcomes and the achievements done in school-based health center kids versus kids that come to us in our fixed health center environments, there's a marked increase in what we can do in those schools, and largely because the kids are pre-consented. The parents have taken an active role to do that. The kids can get to us when they need to get to us, and when we look at things like what percentage of kids have an asthma action plan in school-based health versus those that see us in general practice, it's much greater in school-based health centers. When we look at immunization rates, it's much better in the school-based health centers than it is in general practice. When we look at things like preventive and wellness visits, it's much better. When we look at things like oral health screenings, it's much better in the schools than it is in general community. And so I think we have to look at what isn't broken in that system and say, let's retain what seems to work. And I think if we look at this, the cost trend and the spending on this program, I think you're going to find that we've got a pretty good value out there right now in terms of how prudent we are using those Medicaid dollars. So I think those are great reasons. The other thing I would just highlight, so for those of us that do a few things in the school-based health center environment, so let's say, for instance, again, back to the district run of particularly looking at integration of behavioral health and primary care. I just think we have great opportunities and have shown some great work in the schools to marry behavioral health manifestations in children with their primary care focused on at the same time. And so we do that in schools. When we look at how that would be handled in a managed care environment, most managed care plans parse out what you do as a provider to be credentialed as a primary care provider versus as a behavioral health entity versus as an oral health provider. Many of them have outsourced functions to manage the dental and the mental health components with different companies that manage those benefits on their behalf. And so it becomes much more complex when you're trying to manage that range of clinical things in a patient in that environment than when we're doing it in the school-based health center where we have the ability to address all of those needs in one site. So I think that's really what we would encourage in asking the governor to thoughtfully sign on to this process and see that we could get this fix put in here that allows us to continue to do the great work that we've done and move forward with that. Thank you.
Thank you very much, David. Next, Assemblyman Felix Ortiz, Assistant Assembly Speaker.
Thank you, Sarah. Thank you to all the advocates for really come together today to call on the governor to ensure that this bill will become to be reality. I also would like to thank our champion, Chairman of the Health Committee, Richard Gottfried, for his work on this piece of legislation, and Senator Stewart for finally having this bill passed in the Senate and send it to the governor. I think this is very simple. This is about prevention. This is about prevention. I have 10 schools in my district. I represent the 51st Assembly District in Sunset Park and Red Hook, one of the most underserved community probably around the state. Having 10 centers in my district that had helped my kids in my community, probably over 6,000 kids, to really receive prevention and preventive treatment. As we talk about, and I'm hearing very clearly about mental health issues, and I'm going to just pick on mental health, besides I do believe everything else is very critical, very important. When you begin to look about what happened with bullying around the city and around the state, and what happened recently in the city of New York, you know, these school-based clinics are very critical and very important to address the confusion and the confusion and the anxiety that these kids are facing. I don't know if you read an article in the New York Times not too long ago that it's a lot of kids that are very depressed in our school system right now, and we don't have enough resources to address the need of this anxiety that is happening to our children as a result of what is happening in their homes as we speak. So this school-based clinic, if the governor he's probably not listening, but he probably will very soon. I hope that he understands that this is about the future of our children, and it's about the future of the escalating healthcare costs of our system in New York State as we speak. And if we want to prevent high costs in healthcare, the only way to do it is to begin to provide these services at the early stage of our children's life, where we begin to identify their issues, their problems, and then begin to treat them and develop the strategy and the plan of action to bring prevention. It's about prevention. So therefore, I'm here to call upon the governor to preserve not only my 10 school-based clinic, but also the others around the states, about 250 plus. So I hope that the governor will really take this into consideration, and the governor will think about children and to put children first rather than thinking about Washington too much, to make sure that he come back to think about the state that he need to take care first, which is our children and our children's future. Thank you.
Thank you, Assemblyman Ortiz. Last up is Julie Marlette, Director of Government Relations for the New York State School Boards Association.
Good morning, everyone. I won't take a lot of your time reiterating the many fine points we've already heard today, but I certainly would agree with the points that my colleagues have made. But being here to speak on behalf of the more than 660 districts that I represent across the state, I just want to add my call for action to that of my colleagues. School-based health centers are actually a critical part of the education delivery system in this state at this point in time. When I talk to my members, to our administrators, to our superintendents, one of the most frequent things we hear is their desire to be able to provide more, not less, school-based health and mental health services. And if we were to see a dramatic change in the way these programs are administrated that leads to less efficiency and higher cost, I think that achieving that goal of more would be far more difficult, as would even maintaining the services we're currently providing. What we know is that a healthy child, a child receiving both preventative and remediative care for both physical and mental health services, is a child that misses less school, performs better in school, is more likely to go to post-secondary education, and ultimately earn more money over the course of their life. That's all based in health, but that's also based in education. And I think that's what we all want for all of our students. This is one of those wonderful issues that I get to work on that truly has statewide appeal. It's relevant in Assemblyman Ortiz's district, but as Sarah mentioned, this is also one of the primary and sometimes only source of community-based health care for students living in the most remote and rural areas of our state. On behalf of NYSBA, I'm incredibly grateful to the bill's sponsors, Senator Seward and Assemblyman Gottfried, but also Assemblyman Gottfried in his role as committee chair, and Senator Hannan as well for pushing this through the process. And we look forward to talking more with the governor to ensure that we can finalize this process and remove the anxiety for our school-based health centers before the start of the 2019 school year. Thank you.
Thanks so much, everyone. You made some wonderful points today. The support is extremely crucial and very much appreciated. So we're opening up for questions.
For Assemblyman Gottfried, or I guess either Assemblyman, have you guys talked to Speaker Hasty about if and when this will be sent to the governor's desk for consideration?
The practice is with bills generally that, at least in the last number of years, that when the governor's office is ready to act on a batch of bills, they ask us to send them down. So the Assembly and Senate don't schedule when we send them down. We send them down when the governor's office says, send me the next 30 bills. There are several things that are carved out, all for various particular reasons. Family planning is a longstanding Medicaid carve-out. The state dental schools that have a dental clinic as part of their operation, those dental school clinics are carved out. So there are a variety of things that are carved out. Do you have?
Foster care.
Kids in foster care are exempt from being required to be in managed care. And there are individual populations like foster children that are carved out, but there are also services and providers that are carved out. As I mentioned, family planning, dental school clinics, and the like. And the school health centers have been carved out from Medicaid managed care administratively for 15, 20 years. The health department in the last few years has been pressing to undo that administrative carve-out. This bill would make it state law.
I just had a question. If he doesn't sign this bill, what's going to happen? Would it mean, for example, that kids would be no longer get health services in schools? They'd have to go to their regular doctors or find another doctor? What would happen if it doesn't get signed?
Want me to take that one? The issue is that if these centers have to negotiate their own rates and they are carved in and they are not successful in sustaining the funding that they have now, it is most likely that they'll have to start reducing their services or possibly close their doors. So children would have to go to other sources for their health care, their primary health care, and for some there is no other source.
What do you feel like is kind of the biggest holdup with this bill? I mean, is it funding? Is it like the possible budget deficit?
Well, there's no fiscal attached, so I don't know if I understand what you mean by hold up.
Like, why do you think like the governor hasn't signed it yet?
Well, he hasn't looked at it, he hasn't seen it.
Okay.
He hasn't called for it yet.
Okay. So are you guys like in contact with him trying to get this in then?
There have been conversations, yes, there have been meetings and discussions, sure, with staff.
How long will the carve out last? Do you guys hope to ever transition to the managed care system or be an indefinite carve out?
We're looking for a permanent carve-out, yes.
Is there anyone in particular who's opposed to these school centers?
Opposed to...
Is there anyone, a group or advocates on the other side of this that say that, you know, these school centers aren't good and for some reason, or that fee-for-service isn't good? I mean, what's driving this? You want me to?
Yeah, yes.
You know, to me, school health centers are kind of like Sara Lee pound cake. If you remember the commercials, nobody doesn't like Sara Lee. I don't know any constituency that doesn't like and even love school-based health centers. The issue is that, you know, the state is and has for a number of years been moving the Medicaid program almost entirely into Medicaid managed care. There are arguments pro and con on that we don't have to go into today, but even if you believe strongly in Medicaid managed care, there are particular categories of care and categories of provider where it really doesn't make sense. And school health centers, I think, are clearly one of them. They don't have and couldn't afford the billing staff and the like to be dealing with perhaps a dozen different managed care plans, particularly in some of the urban areas. They could not survive financially on reimbursement rates that they might have to negotiate with managed care plans. And the whole managed care notion that you don't go to a healthcare provider without a referral from your primary care doctor really doesn't work in the context of school health centers. Part of what makes them able to work is that a kid can drop in literally, when their schedule works, when they're not feeling well, when they are feeling ready to talk to a healthcare provider. That's part of the secret sauce of school health centers, and it really doesn't work in a managed care environment.
Yeah, they're unique, and what works about them is that the fact that they are unique. So once we start to carve away with the current model is when we start to lose the ability to serve kids.
Can you give me some sense of how the numbers of school-based health centers have changed over the years? Has there been a lot of new centers opening up in recent years?
There have been across the nation and across the state. In the state, I think we've seen 100 new centers in the last 3 to 5 years. So we're up to 250, or in the last, 9 years. So we've effectively doubled our numbers in the last 2 decades. And across the nation, there's actually school-based health centers in now 49 of 50 states. And their numbers have increased significantly as well.
And school-based health centers, aren't they a key piece of the community school initiative?
Yes, they are. We are an integral part of community schools. Yes, we are. Mhm. Any other questions? All right, thank you, everyone. Thank you so much.